Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and in today's video we're going to talk a little bit about how you can apply your clinical reasoning, your assessment skills to evaluate somebody that has what you suspect to be lateral epicondylitis or lateral epicondylosis, otherwise known as tennis elbow. So just going through some assessment techniques and tools here. These are obviously all available online, Rehab of the Hand. There's lots of resources that you can find these in, but I just wanted to make a video that kind of groups everything all together so that you have an idea of a bundle of tests, basically a bundle of assessment techniques that you can use to properly evaluate your patient that you suspect might have tennis elbow. So without further ado, let's get into it. So the first component of your evaluation is obviously going to be the subjective component. What are their complaints? You want to get a thorough history, obviously, and the clinical picture typically of these patients that have this lateral epicondylitis or epicondylosis. Typically, they're going to complain about pain at the lateral part of the elbow or even into the forearm. They are probably going to tell you that they've had some difficulty doing activities that require sustained gripping. They might have difficulty lifting. Sometimes if it's bad enough, they can even have difficulty lifting something as light as a coffee cup. A lot of activities that require sustained gripping, wrist extension, and certainly with the arm extended in front of you and the palm down, those are all going to be typically aggravating activities. So that's kind of a general clinical picture of what usually patients are complaining of with these symptoms. And some clinical tests that you can run to, again, assess the patient for these symptoms include Mills test, Cozen's test, Maudsley's test. One that I typically will also do is a grip test. So, and we'll kind of go through each of these tests individually, but those are typically things that I include in my assessment. If you have other tests that you tend to include or other things that you think I'm missing, I would love to hear about them. I'm always trying to find more current trends or more current evidence-based practice, ways that we can improve as clinicians. So please post those in the comments below. But for now, let's go through kind of the Mills, the Cozen's, the Maudsley's test, and then the grip test that I typically will run. So first off, Mills test. This test is best done usually with the patient in a relaxed position. They're going to be seated. The examiner is going to passively move the patient through these positions. They're going to palpate the lateral epicondyle while you are doing passive forearm pronation, elbow extension, and then passive wrist flexion. A positive Mills test is going to be replication of their familiar symptoms of pain at the lateral epicondyle. So that's important. If they say, yes, there's pain, you want to ask, where is your pain? Because if it's at the wrist, if it's at the finger, somewhere else, it's not a positive test for Mills test. So that is going to be the Mills test. It's the passive stretch test. The next test that I like to perform is the Cozen's test, which is the resistance test. So we're doing a resistance test on the common extensor tendon. With this test, again, the patient should be in a comfortable position. They're going to have their arm extended in front of them. Their wrist is going to be slightly radial abducted, and I like to have the patients in a fist because if they're in an extended position, you are going to have them exerting more their finger extensors, the EDC, and we don't want that, right? So clinically, you need to have them in a loose fist for this test, not with fingers extended. And then you are going to apply resistance. So you're going to have the patient resist you as you are trying to push the wrist down. So they're trying to push the wrist back up, sort of a tug of war. The cueing that I give patients is don't let me push you, don't let me move you. And so I create the pressure and they start to resist against me. Now, while you're doing that resistance test, it is also important to have palpation over the lateral epicondyle, and that is going to be Cozen's test. Again, the positive test is that they have pain, replicated familiar symptoms at the lateral epicondyle. The next test that typically is a good one to add into your collection or your bundle of clinical assessments is Maudsley's test, or Maudsley's, sorry, I said that so wrong, Maudsley's test, which you may have heard the name. I actually hadn't heard that name before. I've always heard it referred to as the middle finger extension test, but it does have a clinical name, so that's pretty cool. Maudsley's test, I learned something new. With Maudsley's test, we're kind of again testing for presence of lateral epicondylitis or lateral epicondylosis, but more involvement of the extensor digitorum muscle, the finger extensors muscle, versus the extensor carpi radialis brevis or longus, which tend to be the more common sites of irritation, which is kind of what you're testing more with the Cosen's test that we just practiced. So Maudsley's test, you're going to have the patient, again, in elbow extended position. They're going to try to resist in extension on the third digit. So you're trying to push down against that third digit. Again, what I tell the patients is don't let me move you, don't let me push you, try and resist me here. And you're palpating the lateral epicondyle with this movement as well as the clinician. Positive test of Maudsley's test is going to be replicable symptoms of that familiar pain at the lateral epicondyle. And then another clinical test that I typically will run is a grip test. So this is using a dynamometer in the standard rung position, the second rung. You're going to first test them in the standard position, which their elbow is at a 90-degree angle. They're not resting the weight of the dynamometer down, and they're just squeezing as much as they're possibly able to do. Obviously, you're going to compare that with the affected side versus the contralateral side so that you can get a good idea of any differences in strength there that may be due to the pain. And then you want to test in a more provocative position as well. So again, this time you're going to use the second rung again of the dynamometer, but this time you're going to do it in this elbow extended, forearm pronated position, which is much more symptomatically provocative for that lateral epicondyle and the common extensor tendon. And so they're going to grip in that position as hard as they can. Typically, normal result is that the amount that they can grip in the provocative position and the standard position should be very similar. A lot of times they're actually a little stronger in that prone position. But what you'll find is that in patients that have lateral epicondylitis or epicondylosis, tennis elbow symptoms, is that they're going to have a significant weakness typically in that pronated position. So just another nice clinical test. I'm not sure if that one has a specific name. I have not learned the name of that. So if anybody is familiar with like a specific name of that test, let me know. I would love to know. But yeah, those are kind of the four main clinical tests or components of my assessment that I tend to use with tennis elbow patients. So I hope this video was helpful for you. Just giving you a little sense of a bundle of clinical assessment tools that you can use as you are evaluating your patient. And if you enjoyed this video, please subscribe to the channel, give it a thumbs up if you liked it, and I hope to see you in the next one. Thank you guys so much for watching.